Hi, this is Dr. Ange, and today we're going to be talking about medication, friend or foe. Now, my usual disclaimer, I'm not a qualified doctor, but I do have 30 years of personal experience with mental health issues, and I also work as a peer worker, so I'm actually, because of my lived experience in mental health, I'm actually paid to support, encourage, and just journey with people who are going through their own mental health issues. Medication, it's a really big topic. It's a big part of how mental health issues are treated in society. And this talk is going to cover how does medication fit into the medical approach to mental health issues. I'm going to talk about how long it usually takes for medication to work, side effects, and why do people take medication, maybe why not to take medication, and then maybe talk a little bit about the stigma related to medication, and then I'll share a little bit of what my personal journey was with, or has been, with taking medication for mental health issues. Okay, so clinicians, so psychiatrists, psychologists, GPs, people in the medical profession have come to a point where they believe that a lot of mental illnesses are caused by chemical imbalance in the brain. Now, sometimes, they'll say that if you have a lack of serotonin, this could be why you have depression. I think schizophrenia has been linked with lower dopamine levels in the brain. This chemical imbalance idea is what psychiatric medication aims to treat. So the idea is, if there's a chemical imbalance in the brain that's causing mental illness, if we give medication to alter that brain chemistry, it should improve the symptoms for the person. Now, if you go to a GP or a psychiatrist, or if you find yourself becoming really unwell and end up in a psychiatric ward, it's usually the first go-to. The first thing they're going to do, other than diagnose you, is suggest taking medication to treat your condition. And it's really linked to that chemical imbalance idea. Now, if you do your own research, you might be surprised to find they're not 100% sure what the chemical imbalances might be, and they're not exactly sure why the medication works. But their studies have shown that medication does help people with mental illnesses, and it can certainly stabilize your condition. It can certainly help you cope with your condition better. Like in the case of depression, like for me with depression, it's not that the issues as to why I was depressed, it's not like they magically disappeared, but certainly taking medication helps me be able to function. So I still might think about things that have happened to me. I still may be struggling with very real issues that impact my mood, like stuff like struggling with money or health issues, or, everyday life issues still come up and they can really make me feel down. But while I'm on medication, I can actually deal with stuff like that. Whereas if I wasn't on medication, the feeling of depression and darkness would overwhelm me to the point that I would struggle to get out of bed. So medication can be life or death for a lot of people with mental health issues. It gets back to the idea that mental illness is caused by a chemical imbalance in the brain. And it's helped a lot of people stabilize or cope with their lives better once they've been on medication. So for a lot of people, there is stigma attached to psychiatric medication. And I think part of that stigma is feeling like maybe you're weak because you have to take psychiatric medication, maybe feeling like you're not strong enough, or wanting to do it on your own and not rely on meds. Um, those responses are kind of understandable from an emotional level, but they're not very rational. And the reason I say that is if someone had diabetes and they had to take medication for it, you wouldn't tell them, oh, you're weak for taking your diabetic medication, You wouldn't put that on someone. So mental illness, if you're looking at it from just a chemical imbalance, then it makes sense that you need medication to fix the imbalance, You wouldn't criticize someone with diabetes for taking medication. You wouldn't criticize someone who has cancer for seeking out medical treatment. So from that perspective, there shouldn't be a stigma. It's not a sign of weakness if you have to be on psychiatric medication. The other side of it is how long do you take medication for, And this is it, like all mental health, it's a journey, And I think it makes a difference if you are experiencing situational crisis. So if something's happened in your life that has brought on mental health struggles, like say someone's died, or you've been evicted, or your boyfriend broke up with you, or your pet died, whatever it is, something's happened to you and it's triggered your mental health decline, you might only need to take medication for a short while, in order for you to cope with the situation. You might also, as well as medication, you might seek some counselling just to be able to express yourself and get some support and also learn some skills. And, after a few months, you might find that you're doing a lot better. Talk to your GP about coming off medication. And I say this because some people just stop taking medication when they feel better. It can be really dangerous. Some medications, some psychiatric medications, you have to taper off. You have to come off them slowly. So it is something that you should talk to a professional about if you decide to come off it. But yeah, it might be that being on medication is only for a short time of your life. If you have acute mental health issues, so acute mental health issues are usually diagnosed as long-term issues, things such as bipolar disorder, schizophrenia, obsessive compulsive disorder, I can't think of a lot, schizoaffective disorder. So these are more long-term mental health issues. And so usually with a long-term mental health issue or an acute mental health issue, and I will do a separate video on situational crisis and acute mental health issues. Usually if you have a long-term mental health struggle, then the decision on whether or not to take medication for the rest of your life, it's a big one. And again, mental health is a journey, and a lot of people want to see if they can do it on their own. They want to see if they can learn to cope with their mental health struggles without using medication. And that's fine. I did that in my 20s. I wanted to see, can I deal with this without being on meds? And sometimes I was okay, and sometimes I was not. There was other things happening in my life that made it worse. But definitely when I was in my 30s and it came to being a mum, I thought I need to be able to take care of my son. I can't afford to be so depressed that I'm suicidal and not able to work or take care of my boy. And medication was the quickest, most stable way of fixing that issue. And I think that's the decision people have to come to in themselves. There's no stigma. There's no need. If you've got an illness, then taking medicine for your illness to help you get better makes sense. But you have to come to that conclusion on your own. And, some people might cope without medication, and that's okay. But I personally believe if you are struggling, Like, I remember there was a client who I worked with that had anxiety, really bad anxiety, like full on panic attacks, heart racing, sweating, thinking he was going to die because his heart was racing, and it was constant. And he'd wake up with that feeling in the morning and it would not settle down. Now, he had been on medication earlier in his life. I think he was in his 50s when I worked with him. He'd been on medication earlier in his life and it had helped. And then because he was feeling better, he'd stopped taking medication, and that's okay. He had done some other stuff like to work on his personal issues, and that's cool as well. I don't think he'd ever gone to a psychologist or a counsellor, but he'd done some workshops where they focused on personal issues and, weekend retreat kind of stuff, and, all good. And that helped. Whatever he was personally struggling with helped. But then the anxiety started coming back. And when it started coming back, it was debilitating. It was meaning he couldn't work, and meaning he couldn't take care of his family, and, you know, he couldn't sleep because his heart was racing and he had that full on anxiety. He thought he was going to die because his heart was racing and he was just so overwhelmed with fear and worry and why is this happening, and my body's feeling so out of sorts. Like, he didn't want to kill himself, but on the other hand, he didn't want to feel this huge burden of anxiety that was, stopping him from living a normal life. So when I worked with him, um, I I got him to, we wrote down the stuff that he had tried in the past and the stuff that had helped, and compared it to where he's at now. And, he said these workshops where, I think they were weekend retreats, they had helped. And, there'd been a few things in his life that had helped with his anxiety. I think he had anxiety all his life, but there were times where it was worse than others, okay? But he said the most helpful time as far as coping with the anxiety was when he was on medication. And so it was like, okay, if that's been the most helpful time in your past as far as coping with your anxiety, do you think maybe now's a good time to get back on medication? If it means you don't have to feel like you're feeling right now, and if it means it can settle your anxiety down enough that you can function, are you open to being back on medication? And he said, yeah, I guess I have to do that because nothing else has worked. And that wasn't me trying to convince him. It was just talking with him and writing it up so he could literally see, okay, this worked, this didn't work, or it didn't work as well as this. He could actually make a comparison for himself as to what gave him the best results in coping with his anxiety and in being able to function so he could do what he needed to do. And I think that's what the decision comes down to. Now with him, I remember we did have a conversation about how going back on medication was not a sign of failure. If you've tried to be off meds and you find yourself at a point where you need to go back on, that's not a sign of failure because you've tried your best. I think it's actually a sign of strength when you recognize that you've done all you can to help yourself. And now you need to look at it from the chemical imbalance perspective. You need that medically sound treatment option, which is medication. And if it takes all the pressure off, and allows you to function and allows you to take care of the people you need to take care of, then do it. Life is hard enough without struggling with mental health issues. If medication can make a difference and you've had experience where it's helped in the past, go for it. Okay, so once you have decided if you want to take medication, it's good to know, like, usually it will take, they say, 2 to 8 weeks before it really starts making an impact on your mental health. Over those first few weeks is when you can experience a lot of side effects. So dizziness, nausea, headaches. It might make you really groggy. It might make you sleep a lot. You might have difficulty focusing. Obviously, depending on what medication you're on, the side effects will be different. One of the worst side effects, I think, for people is that sometimes you can actually make your symptoms worse. So you can start on a new medication, say for anxiety or depression, and for those first few weeks, your anxiety and depression might get a lot worse before it gets better. With most of the side effects, once you hit that, 4 to 8 week mark, the side effects will settle down. It's a good idea to be, to have pretty good contact with your mental health provider. So whether that's a general practitioner for people in Australia, I don't know what they call it in England and America, whoever your main doctor is, or if you're going to a psychiatrist to get medication, it's good to have a good flow of communication with them so that if you do have side effects over those first few weeks, they can let you know if it's normal to have those side effects, and they can help you decide, is it worth staying on the meds and getting to that 4 to 8 week mark and seeing if it makes a huge difference, or if you feel that the side effects are just way too much to deal with and you need to stop taking it. One of the most dangerous side effects of psychiatric medicine is that it can actually cause suicidal thoughts, irrational thoughts, and extreme mood swings. Now, not all psychiatric medication will do that, and it's like in extreme cases when psychiatric medication can have that side effect on someone. So it's meant to help, can actually make you a lot worse. That's why it's really important to be in a good communication with your mental health practitioner, because if you are already struggling with mood swings and irrational thoughts and suicidal ideation, if you're already having those things and you're taking something that's supposed to help with those things and all of a sudden it's made it worse, you need to be able to talk to someone and really get help as to whether to keep going on the meds or whether to stop. Another thing with medication, and I probably will mention this a few times throughout this talk, if you do have to stop taking psychiatric meds, check with your mental health practitioner what the best way to do that is. Some of them you can just stop, but other ones you have to stop slowly. You have to taper off slowly, or it can be really dangerous. And some medications you also have to start slowly. So you'll start on a small dose, maybe half a pill or whatever, and then slowly build up until you get to I think they call it a clinical amount. That might not be the right term, but until it actually gets up to a dosage that is actually beneficial. And the reason they do like a slow build up with medication is so that your body can get used to the new medication being in your system, and also so that it slows down any side effects that might be caused by the medication. It just gives you a bit more time to ease into that change. I will say you've got to be so patient with medication. It can help long term, but when you're first starting on it, it can be really frustrating because it takes a few weeks before it starts making a difference. You've got side effects to put up with. You got to be patient with yourself and with the meds. And if you can go through the side effects and if you can get to that point where it starts helping, that's really good. Some people won't cope with the side effects and they'll be like, nah, I can't deal with this. Let's try something else. Or they might decide, I don't want to do meds at all because I don't like the way they make me feel. That can be unfortunate if you, especially if it's the first time you're trying medication for mental health issues. It can be unfortunate if you write it off before you've really given it a chance. Now, I'll give an example. I had a client who said she had tried medication and it hadn't done anything for her. And okay, that can be the case for some people. But when I actually asked her, well, what was it like? What medication were you on, and how long were you on it? And she told me that she had been taking a quarter of a pill over a few days, and then because she was going okay, she increased it to half a pill for a week. And then because it wasn't doing anything for her, she stopped taking it. And so in her mind, that was her experience, was that she had tried medication and it hadn't done nothing for her. The thing is, if you're only taking a quarter of a pill or half a pill and you're only doing it for a week, that's not a therapeutic dosage. That's the word I was trying to think of before. Therapeutic dosage is, a substantial amount of a medication to be addressing the chemical imbalance in the brain. You're not going to get that with quarter of a pill or half a pill after a week. If you do have to build up in your dosage, again, it'll be at the 4 to 8 week mark where you're actually taking enough and it's been in your system long enough to actually be making an impact on the chemicals in your brain. So yeah, don't give up too soon. Is I guess what I'm saying is, if you haven't tried medication before, if it's all new to you, be patient. Understand that it does take a while to build up in your system, and it does take a while for it to have an effect on what it's meant to be treating you with. And if you can get through the side effects and get to a point where you can see that it's helping you and the side effects aren't, making life harder for you or too hard for you, that's a really good space to be in. I wanted to say about the side effects of medication. Usually you will just experience the worst of the side effects in the first few weeks of trying a new psychiatric drug. But there are some medications that will have ongoing side effects. And this is part of the difficulty in deciding, whether you should be on medication or not. It really is a case of weighing up, is the benefit of these meds worth struggling with the side effects? Are the side effects something I can live with, or are the side effects just too much and I'd rather not be on this medication? I'm going to share some of my own experience with that. So when I had the manic episode when I was like 18 or 19, they put me on lithium. Now, lithium is the drug, the medication that is traditionally used to treat bipolar disorder. Bipolar disorder used to be called manic depression. It was actually like one of those breakthrough drugs when they first discovered that lithium could help bipolar disorder. It was revolutionary, and it helped a lot of people be able to stabilize their mental health, rather than get stuck in these up and down mood swings, or go through periods of intense depression and then go through periods of full-on mania. Lithium was an amazing option to be able to offer people in treating their bipolar disorder. For me, being on lithium was really bad. So for me, I think when I was in the psychiatric hospital, I think they had me on something else as well as lithium. But then when I left the psychiatric ward, I remember lithium was like the main medication they had me on. I think I had some temazepam to help me sleep as well. With lithium, for me, it turned me into a zombie. That's the only way I could describe it. My head was really foggy. I could barely talk. I could barely focus. I slept a lot. I remember I was with somebody I was studying with at the time, and we bumped into another lady, and the lady kept sort of looking at me weird. And I remember feeling it was weird that she sort of kept looking at me It was like I wasn't understanding something. And then later, it turned out that the lady was actually one of my best friends from primary school, and I hadn't recognized her at all. And that's how out of it I was on lithium. Um, I was on lithium probably for, I think it was about a year. So it wasn't a case of be on it and didn't like it and couldn't cope with the side effects. Um, so I just stopped. I really tried my best to stay on it. And, especially at the time, I was told this is the drug that is going to help you. This is the medication that is going to help you. This is the only medication that's going to help you. And you need to be on this for the rest of your life if you want to get better. So for me, when I decided to stop taking it, it was a huge decision because I was like, I can't keep living like this. I just felt like a zombie. My head was foggy. I was just so out of it. There was no way to live. And unfortunately, I don't think I think I was pretty fed up with the whole mental health system at that point. So I didn't um, consult anyone about stopping. I don't know if lithium is something you're meant to taper off. But definitely later on, when I was still really depressed and really suicidal, and I decided that I wanted to get some help from the mental health system, I had a caseworker, and she was able to get me onto a good psychiatrist. So I said to them, look, I will try medication again, but I don't want to feel like I did when I was on lithium. So I don't want to go back on lithium. I need to try something else. And it was really good because together we found something else. And I think it was called Tegretol. And that's a medication that I think traditionally is used to treat epilepsy, but it has had good results in treating other conditions. I've heard of people like I was given Tegretol for I think my depression or my bipolar. I've said before I don't really agree with the bipolar diagnosis, but whatever they decided was wrong with me, the Tegretol helped. But I had heard of people being given Tegretol for anxiety as well, and I think it's helped them. Um, I think the most important thing with medication is, be patient, do your research, so know what to expect, know what kind of side effects it can have on you. Um, be in communication with your mental health practitioner, whether that's a GP or a psychiatrist, and also be honest with yourself. If it's helping, that's awesome. If it's helping whatever you're struggling with, that's a really good step. Um, the next decision, I guess, is with medication. Is it something you need to take short term, or is it something you will be taking for the rest of your life? And I think that in itself is different for everybody. If you've got a situational crisis, um, things have happened in your life um, and have put you in a really bad place mentally, you might just need medication for a few months, just to get through that hard time, like if you're going through financial struggles. And yeah, like with medication, if you've got ongoing mental health issues, like if you've been diagnosed with a mental illness, then medication is something that you might have to take for the rest of your life, or it might be something that you take when things are really bad, and then when things settle down, you might decide to come off your medication. It's a personal decision, and it is different for everybody. But one thing we do see a lot, like working in a psychiatric hospital or working in mental health, when people have got like an acute mental illness, like a formal diagnosis for a mental health condition that is going to be affecting them for the rest of their life, we do have a lot of people who will continually get off their meds, okay? So they might be on medication for a while, they'll be doing really well, and then they decide to stop their medication, and then their mental health deteriorates to the point where they have to go into a psychiatric hospital, and then they're on medication again, and then they stabilize, and then they're doing really well for a while, and then they decide to get off medication, and then they end up back in a psychiatric hospital because their mental health deteriorates. So it's really sad when we see that, because just from their pattern, you can see that when they stay on their meds, their life stabilizes. And when their life is stable, they're able to do stuff like, maybe work, or maybe study, or maybe socialize more, or maybe just be happier, Um, I haven't done a video yet on what does coping or functioning with a mental illness look like. It looks different for everybody, So I will talk about that on a different recording. But as far as people who've got ongoing mental health issues, and their relationship with medication, it can be really volatile. Part of that is the stigma connected to being on meds. People feel like they're weak, or, if they don't just deal with it on their own, they feel like a failure if they have to use meds. That's not true, but it's how people sometimes feel. Sometimes it can be because people are in denial about having a mental illness. That can be really hard. It can be really hard to accept that there's a chemical imbalance in your brain that is affecting your life, and that medication might be the best option to treat it. Like, that's a huge thing to accept about yourself, and some people never accept it, and they might be on and off meds for the rest of their life. Yeah, it's hard because you got to respect that everybody's on their own journey with mental health, and everybody has a right to decide for what is best for themselves. I think in Victoria, which is the state that I live in Australia, there are laws where the mental health system can force you to have medication if you refuse to do so. I don't really know a lot about those laws. I don't really know how much, how it works or not. I know it would have to be a really extreme situation for a person to be on a order where they're forced to have their medication. It would have to be a pretty horrible situation to get to that point. But sometimes I guess it's required. But overall, what I encourage people, to be practical. If you've been on medications and have gotten good results in your life while you've been on medication, and if you've been off medication and your mental health has deteriorated when you've been off medication, then maybe staying on meds and staying on them for the rest of your life just might make your life a bit easier. If it saves having to be in and out of psychiatric wards, and I mean, every time you go into a psychiatric ward, when you come out, it's like you're starting all over again, and it's a struggle. I don't want to talk too much about that now because I want to focus on the medication side. But yeah, everybody's different, and everybody has to decide for themselves. And I'm not saying medication is the only way to treat mental health issues. But as far as the easiest, quickest, most stabilizing method of getting on top of a mental health issue, medication does the trick, And if it means taking medication enables you to be stable enough to get on with other parts of your life, that's awesome. So these are things to keep in mind. The other thing I wanted to say, because it's not just about medication. So if you can take medication and that can stabilize you so that you can function, that enables you to, maybe go to therapy, maybe find a psychologist and talk about what you've been going through. Or maybe if it's a situation that has caused you to be in a mental health crisis, go to a counselor and talk about the issue and learn new skills and coping strategies so that you can cope in whatever you're going through, and you can apply those skills if it comes up again in your future. Like, if I always think of grieving for some reason. So when somebody close to you has passed away and you're heartbroken and you're suffering, you're crying, and you're lonely, and people don't understand, getting grief counseling can be really beneficial. You might still need to be on medication over that period of your life, but at least you can also, in addition to medication, seek out somebody who can teach you how to cope with grief. And it might mean that, if somebody close to you dies again in the future, you might not need medication to get through it the next time, Like, you'll know it's going to be hard and you'll know it's going to be heartbreaking, but you might not need the chemical side of it to help you get through a tough time. You might have already developed enough skills because you spoke to a counsellor last time and you learned how to cope with grief. So, yeah, medication isn't the end-all or be-all, but whether it is the right decision for you is a really important thing to weigh up. Thank you for listening to Dr. Ange on medication, friend or foe. As I always say, mental health is a journey, not a destination. I hope you've all been travelling well. Please subscribe, hit the like button, and check out my Patreon. Details are on the screen. And yeah, I really appreciate your support. If you'd like me to do an animation of your mental health journey, please contact me by email and I'll get back to you. All right, hope you're all well. Bye.